Good morning. My name is Bonnie Jackson, and I am a volunteer with the ARP Arizona Community Education Program. This is a volunteer-led program that offers basic conversations on Social Security, Medicare, caregiving, fraud, finances, and more. Today, we have several of our very valuable volunteers joining us: Jerry Waterworth, Joyce Brangle, Gary Snyder, Linda Vitale, and Rob Foster. Our goal today is to share information about the ABCs of Medicare, Medicare Advantage in particular, and our objective is to give you basic information on the Medicare Advantage program. We're going to look at such topics as who qualifies for Medicare, hospitalization, medical care, prescription drug coverage, and the Medicare savings plans and extra help that might be offered, and Medicare enrollment periods. And finally, we'll give you a list of resources that are very helpful that you could go to if you have specific questions about your personal situation and you want some guidance in making your choice. Our first topic is to who qualifies for Medicare. It's anyone who is 65 years or older and has earned 40 credits during their work history. Every quarter that you work and pay your FICA taxes in, you will receive 1 point. So each year that you work, you could earn 4 points. And after 10 years of employment, you would have your 40 credits. Now, this doesn't have to be 10 years of consecutive work, because some people start working for a period of time and then quit to start a family or to travel or for whatever reason, and then they come back and start working again. As long as you have accumulated over your work history 10 years of paying your FICA taxes, you would qualify at age 65 or older. And if you're younger than 65, you are still covered, if you're covered, by Social Security disability insurance for at least 2 years. After that, you would automatically be covered with under Medicare. And finally, anyone with end-stage renal failure qualifies at any age. And that is also true with Lou Gehrig's disease. Okay, Part A has to do with your hospitalization coverage. And as an inpatient care, you have to be admitted. So a lot of people go to the emergency room because they have a situation and they may be treated and sent home. So that would not be covered under your Part A. You would have to be admitted into the hospital and stay a day or more, and then you would be covered under your Part A insurance. If you have an HMO, which is a health managed organized plan, you must go to a hospital that is within the network. They also offer a PPO plan under the Medicare Advantage, and that is a preferred physician organized plan. And that allows you to choose the doctor or the hospital or specialist you want to go to. It still needs to be within a network, but the network is much wider than the HMO one. After surgery in a hospital, sometimes a doctor will want to have you go to a skilled nursing facility for aftercare. So that would be covered as well. And hospice for end of life care. It's not covered under the Medicare Advantage plan, but Medicare covers it. So they would take care of that for you under their original coverage. And finally, home health care. Sometimes instead of going to a skilled nursing facility, they may want to follow up with you while you're at home and send a nurse to come and help you with medications or perhaps some in-home physical rehab. That would be covered as well. There is no premium because, as I said earlier, while you're working, you are paying your FICA taxes, and that's what's going to take care of your premium for Part A. So it's covered already. There is no deductible. And yes, there is a copayment. You need to read your policy because every policy is going to be different, and it will tell you how much money it will pay per day for for a set number of days per episode. So if you went to the hospital and you were admitted, and you were in the hospital for 5 days, you can see how much is going your policy would pay for each of those 5 days. So what you want to find out is how much they will pay and for how many days you would be covered, because that can help you make a decision as to which plan you want to get. And there is no coinsurance with Medicare Advantage. Part B would cover your medical care, which is going to doctors or specialists. Once again, it needs to be in network. Also, you also need a referral. You would go to your primary physician and they would give you a referral if you were going to a specialist. With a PPO plan, you don't need that referral. You can just go within network. You would also, if you had outpatient care for like a little minor surgical procedure and you were not staying overnight or anything, that would be covered. Durable medical equipment like wheelchairs or walkers, and also preventative services. There are some standard health things that help prevent major illnesses that would be covered, like a mammogram, yearly mammogram for women. They also include like silver sneakers so that you can keep healthy and fit. There is a premium. It is $145 a month, but it is means tested. So if you have a really good retirement and you make a decent amount, that rate might be higher. This, a lot of people just have taken out of their Social Security and automatically sent over to pay for that. There is no deductible, and the copayment, yes. Now, with original Medicare, Medicare pays covers 80%, and you usually get a supplemental and policy that would cover the 20% that remains. With Medicare Advantage, you will have a copay, like if you go to a doctor, but it is considerably less than 20%. It might only be $20 per visit. It might be $50 for a specialist. It says except in some cases. So once again, you have to refer back to your policy and find out what those exceptions might be. There is no coinsurance, once again. So you want to read through your policy and find out specifically what that refers to. On prescription drugs, the coverage is included in a Medicare Advantage plan unless you specifically purchase a plan that does not include Part D. The premium, there is no premium, but it once again is means tested. So if you have a pretty strong retirement income, they may charge a small premium. On the deductible, some plans do have a deductible, but most don't. So once again, I'm going to refer you to read your policy and see. A copayment, yes, and it's going to depend on the drug tier. And I can tell you from experience, this can change from year to year. If you have a prescription drug that is like a maintenance drug, it may start out as a tier 4 drug, which is pretty pricey. But then over time, there may be a generic that comes out and they will offer that would drop you down to a tier 1. So your prices could vary depending on where your drug ends up. And some companies literally stop covering certain drugs at times. You have to check and make sure that your prescription drugs are covered by that plan. And the coinsurance that goes with it, in general, you're going to pay 25% of the cost. The plan will pay the rest. But when you have, like, some drugs are extremely expensive, and if it's a maintenance drug and you're taking it over and over again, once you reach a threshold, which is like $6,300, then that's considered a catastrophic level, and your copay would only be 5%. Okay, now I'd like to introduce Jerry, and he's going to cover the Medicare savings programs and extra help that Medicare offers.
Great. Thank you, Bonnie. We want to touch on the Medicare savings plans that are available plus extra help. And this helps pay for some of the premiums and some of the costs related to Medicare. This applies to both Original and Advantage and is mainly based on income levels. And there are several options here. There are Medicare savings plans in Arizona, typically Access. First is QMB, or Qualified Medicare Beneficiary. That may pay for part of Part A, but also for Part B. Next is the SLMB, which is a specified low-income Medicare beneficiary, which helps pay for Part B premiums. And the QI, or Qualified Individual Plan, which pays for Part B. And as I said, in these cases, it's mostly based on income. And if your income level falls below, as an individual, $1,084 a month, or $1,457 per month as a couple, you may qualify for this assistance. And next is the Medicare Extra Help, or Low Income Subsidy, which helps pay for Part D, or drug costs. And with that plan, if your income falls below $19,140 this year, and that's annual, you may qualify for this extra help or low income subsidy to help pay for your Part D drug costs. Next is a very important piece of information, and that's the Medicare enrollment periods. Now, initial enrollment for everyone is when they reach age 65. It's the period from 3 months before they hit 65 through the 3-month period after they reach 65. So just as an example, my birthday is next June. I will be 65. So my initial enrollment period runs from March of next year through September of next year. That's when I can sign up for Medicare as the initial enrollment period. If you miss that, you will need to wait for the general enrollment period, which we'll touch on in a second. And please note that there may be penalties in the future if you do not sign up for Medicare during this initial enrollment period when you're first eligible for it. Now for general enrollment, that period is January 1 to March 31, and this applies if you missed your initial enrollment period. During this time, please note that penalties on the premiums for late enrollment may apply, and that's 10% per year for Part B and 1% per month for Part D. Those penalties, if incurred, will apply forever. And that's only if you miss the initial enrollment period. That's why it's so important to be aware of that initial enrollment period to begin with. Medicare savings plans generally will help pay for those penalties if you incur those. And coverage, importantly, doesn't start until July 1 of that year. So you can sign up between January 1 and March 31, but the coverage won't begin until July 1. So next is the special enrollment. And this occurs if there is a life event or changes in other coverage. Typically, it's if you lose coverage that you've had. If you're 65 and you have up to 8 months to sign up after your creditable coverage ends. And that means if you've been provided employer coverage previously, that comes to an end. Generally, you will receive a letter from that insurance company saying that you have had creditable coverage. Present that to Medicare, and you will be able to avoid any penalties for not having signed up for Medicare at 65. Please note that COBRA is not considered creditable coverage. So although you may have COBRA coverage at the time you reach 65, you should go ahead and sign up for Medicare and end that COBRA coverage. And certainly discuss this with your HR department. If you're employed and have access to someone in human resources, please confer with them and they will give you all this information as well. Currently, we're in a very important period, and it comes up every year, called open enrollment. This runs from October 15 to December 7 every year. And this is your opportunity to, if you're in Medicare currently, review your coverage, make changes that you want. For instance, move from original Medicare to Medicare Advantage or back, or change your drug plan. There is a special Medicare Advantage open enrollment period, which extends into the new year from January 1 to March 31. You can change if you make a late decision, don't like the plan you enrolled in, Medicare Advantage or Part C plan, you can change that plan, or you can return back to original Medicare during that period. Now, please be aware, if you are in a Medicare Advantage or Part C plan and want to move back to original Medicare, you should be aware that there may be a pre-existing condition element to that. If you want to buy a supplemental plan or Medigap plan to help pay for the out-of-pocket costs with original Medicare, you may be subject to underwriting by that insurance company, their private insurance policies, and the premiums may reflect your health conditions. But by all means, we'd like to suggest that you be proactive, and everybody should be. So if you receive Social Security currently, you may automatically be enrolled in original Medicare, Parts A and B, but not automatically in Part D. So be sure to do that if you turn 65 and are eligible at that point. Enrollment takes place through the Social Security website, ssa.gov/benefits/Medicare. But again, please do not procrastinate or avoid a decision. There are many decisions that have to be made, and there are important milestone dates that should be met in order to avoid penalties down the road. Some of the medical resources that are available are actually plenty. There's a state health insurance assistance program, or SHIP, available to everyone at www.shiptacenter.org. You simply enter the state, and the information will be presented that you can use locally. Also, the Area Agencies on Aging at 800-432-4040 is a very helpful resource. They have knowledgeable staff there to help you work through some of the questions you might have about Medicare. They can be reached by phone, or you can schedule a counseling session with them. Also, we'd recommend the Medicare website at www.medicare.gov, 800-633-4227. It's a very helpful website. You can use that to find drug plans. You can search through Medicare Advantage or Part C plans that are available to you in the area you live. You can also find resources for Medigap or supplemental plans through that website. And we'd also recommend the AARP website at www.aarp.org/MedicareQA. You may also call 888-687-2277 for further information. If you have specific questions you'd like to ask through AARP, we're anxious and willing to help you out. So we'd like to thank you for joining us today. This was a summary of what's available through Medicare Advantage. We've done previous videos about original Medicare, which you can research as well. And we'll have an upcoming video coming with questions and answers that we've received from people helping you through the Medicare process. It can be a daunting task. We hope you'll get informed and sign up for Medicare when you're available to do that, or make the necessary changes that you need to make through open enrollment, which is going on right now. Thanks again for joining us.